Okay, so I'm going to go through the meeting ground rules. Everyone is going to stay muted during the presentations, and at the end, we will ask if there are questions, and then you can come off audio and video, and you can raise your hand to ask a question. The non-English speakers will ask their question in their own language. The interpreter will interpret the question in English for all participants to hear. So in order to do that, the interpreter will switch to English to ask the question and then toggle back to your own language to reply what the answer was in your channel. I'm going to now turn it over to Alexandra. She is one of the trustees on the board for the Schinzel-Giedion Syndrome Foundation, and she is going to go through the meeting goals for today. Alejandra?
Thank you, Dana. Thank you, everybody, for joining today on our family meeting. I will go through meeting goals before we go to the panelists. So on today's meeting, we are here to celebrate International Schinzel-Giedion Awareness Day, which is November 13th, but we are meeting today. So it is very a special occasion for all of us parents and our kids. And for today's topics, we will share knowledge of gastrointestinal and diet experience and knowledge from some of our moms and one mom outside of the group who specialized in blended diet. And of course, today's goal is to encourage discussion among families. We want this year family meeting to be more private, so we can share our experiences more and possibly learn something new that we didn't know already, because you all know that we mostly rely on each other's experiences. And of course, we will also remind everyone that in January, we will have a meeting with Dr. Carol Ernst and Dr. Alexandra Sessa to hear the new next and exciting news about ACO updates. So we will encourage you to save the date, 12th of January, 2025, 11 a.m. East. And also, we encourage you to invite your child's doctors because everyone is welcome. Okay, Dana, can you go to the next one? Okay, here we have all our kiddos in this year's logo. This year topic is small but mighty, as all our kids are very mighty. And this year yoga was created by Emma Hudson, our trustee's husband, Steve. So we would like to thank Steve for creating the logo and to thank Karina for coming up with the small but mighty topic, and as well to create all these amazing photos of our kids inside the logo that Steve created. Okay, we are going to panel discussions. So we will have to separate panel discussions on this meeting in two parts. First part will be introduction to gastrointestinal issue in children with Schinzel-Giedion syndrome, and we will have two moms speaking, Emma Hudson, mother to Jude, and Kyla Knight, mother to Theo. And of course, after their panel, you will have some time to ask the question, and we will discuss more about these issues with our kids. And the second part of the panel will be introduction to use of blended diet in children with SGS. But the speakers will be Karina Olson, mother to Emma, Damaris Higuera, mother to Sadie, and Christy Weigand, mother, advocate, creator of the online community called Blended Hope. Thank you very much for everybody to join. And without further ado, I will pass it to the first panelist, Emma Hudson.
Hello, good afternoon, good morning, wherever we're joining us from in the world. It's lovely to see everybody, and I'm so pleased to be able to welcome you all again to the SGS Family Awareness Day presentations for 2024. So my name is Emma. I'm one of the founding trustees of the SGS Foundation. My son Jude was born in 2018 and diagnosed with SGS at around 3 months old. Jude died in 2022 due to complications of SGS and advancement of the disease. During his lifetime, his care became extremely complex, particularly around feeding and digestive and gastrointestinal issues. And I'd just like to share a brief summary of some of the issues we experienced, because I think it might help other families feel less isolated in their own experiences. And then I'd like to ask Kayla to share a little bit about her experiences with her son Theo. And at the end of our little section, I'd like to ask a few questions to the families attending today. And we, as the SGS Foundation, would like to learn a bit more about this area of the disease, with a view to potentially in the future being able to look into research which may help our children. Okay, so I've broken this topic down into two areas. The first of that is reflux and vomiting. So by reflux, I mean extreme vomiting and issues with food or milk regurgitating up from the stomach up to the esophagus. We're not talking about a little bit of sickness every now and then. We're talking about absolute extreme sickness, projectile vomiting happening several times a day. Jude was diagnosed with reflux, and we started to note these issues within a few hours of birth. And I'm not sure, and I would be interested to hear slightly later, when other people noticed that their children were suffering from these symptoms. Almost as soon as he was given a milk feed when he was born, he began to be sick. And it just gradually got worse and worse. The impact of this for us on our family was absolutely massive. Really, we were unable to leave the house at times, because if we tried to move Jude after he'd been fed, then we would have extreme vomiting. The amount of laundry was absolutely ridiculous, which I'm sure many of you parents on this call will be able to relate to, how much washing an SGS child manages to, it's quite amazing. Really, there was a failure to thrive, a lack of growth with Jude, because he was unable to keep any food down, any milk down into his stomach. Every time he was fed, he would then aspirate, so the milk would rise up and it would either come out or then go back down, unfortunately, into his windpipe, causing several chest infections. And most importantly, it was extremely distressing for us and to see Jude being so sick, and also for Jude as well. We tried lots of different treatments, and I would be really interested to know as well what other people's experience of this was. Initially, we were given Gaviscon, so the very kind of basic standard reflux medications that you or I might take. That didn't even touch the sides one tiny little bit, and the vomiting continued. We began to use a suction machine very early on in Jude's life, trying to help him clear the vomit that he was unable to cough up himself from his nose and from his mouth. We tried sitting him upright to feed him. We tried feeding him much slower. We tried about 1,000 different types of bottles to see if he would be able to suck better on different bottles. And eventually, I think as many of our families experienced, we moved down into having a feeding tube. So initially an NG tube, then a gastrostomy, and then eventually a jejunostomy. We tried lots of different medications. I made a list before I came onto the call of some of them: Gaviscon, lansoprazole, omeprazole, ondansetron, you name them. We've tried them with little success, really. We tried changing his milk in case there was an allergy to the type of milk feed he was receiving. And that didn't really make any difference either. The thing that seemed to eventually help Jude to be able to keep the feed down was moving to a jejunostomy feeding tube. We didn't try a blended diet, so I'd be really interested to hear later on in the presentation if that's something which perhaps could help with reflux. So yeah, and an alternative that I know can sometimes progress from a gastrostomy or a jejunostomy is moving on to the TPN feeding, which is where the child receives nutrition intravenously. So at that point, I'd just like to bring in Kayla, who is on our call today, and Kayla is mother to Theo. She has a lot of experience with different types of feeding and the issues that this can cause in SGS children. So I'd wondered if Kayla would like to come in at this point and just talk a little bit about her experiences with Theo for me. Are you there, Kayla?
Okay, can you hear me?
We can.
Okay, great. Hi. Yes, so I'm not really sure where to start. I guess I'll start from the beginning with Theo. So when Theo was born, we had no idea anything was wrong with him. But at 3 hours old, he turned purple and cyanotic right after I had tried to give him a little bit of formula. And they took him back. They thought he was posturing like he was seizing. And he was transferred to the NICU an hour away from us. And then his belly was very distended. And when I say distended, I mean like huge. And they did biopsies and tests. We couldn't feed him. So he was hooked up to IV fluids and a TPN. And we found out that he had Hirschsprung's, which I don't know if there's any other families here that have had a positive diagnosis of Hirschsprung's. So he had a colostomy placed at 13 days old, along with a G tube, because they didn't think he would be able to eat by mouth or take in enough nutrition with everything going on in his brain. So he did well with the G tube. I actually was able to nurse him for a while. And then it was probably about 6 or 7 months. We tried to reverse his ostomy. It did not go well. He ended up with an ileostomy. And he started vomiting a lot after that. So anytime he got sick, he would develop this feeding intolerance. And we've tried, he was switched to a GJ tube. We did J feeds for a while and he got better. And then we slowly put him back to G feeds, and he tolerated that for a while. But every time he got sick, it was he tolerated less and less for longer amounts of time. So fast forward to this fall, September, he got sick with rhinovirus. And we had to go to the hospital. He was on respiratory support, and we figured we'd be there for a couple of days. But then he just would not tolerate feeds at all. He would vomit a lot. His respiratory rate would go up. His heart rate would go up to 170s. His O2 stats would decline. So we were seeing a lot of intolerance. So we worked for weeks and weeks, for probably about a month, with him on feeds. We tried this medicine called octreotide, and we tried it twice. It was recommended by a GI motility specialist in Orlando, but unfortunately it did not work for Theo. We also tried azithromycin, which had worked for him in the past. Unfortunately, this time it didn't, and he's been on famotidine since he was born. So at this point, we also didn't know Theo had just declined a lot. So we weren't really sure where we were going. So we wanted to just get him home. So we took him home on TPN and lipids. However, the thing that the doctors and I have not been able to figure out is at that time, he was able to tolerate his meds through his jejunum. So we aren't really.
Oh, you're muted, Kayla.
Okay.
There you go, you're back.
Yeah. Okay. So we went home. Theo perked up. We saw Theo again. Our thing with Theo is as long as Theo keeps fighting, we will keep fighting for him. Because we don't want him to suffer, but we want him here with us. So we wanted to see what Theo would do when we went home. And he was doing great for 10 days. And then he developed a line infection, a staph infection in his central line, which was a strong one. It kept coming back positive. So he was on some heavy antibiotics. At that time, he started vomiting a lot. And when he vomits, he turns really red. And his stomach makes these really loud sounds. And we have his G tube vented, and it comes out of his G tube. And then, so we have been talking with a hospital in Cincinnati. They have a gut motility specialist there. They have some advanced therapies. I think that we don't have anything to offer here, or they don't have anything to offer here. We've already been denied by a couple of GI motility specialists in Florida. And they wanted us to try a med called Motegrity, which the hospital we're at has never used before. I think they've only used it in adults, but they got the dosage and everything. We were going to start this week. However, Theo started vomiting again for about 3 to 4 days now, inspective fever. And at that point, the doctor said this week, we really don't think this is the best option right now to try this new med. And so on Tuesday, they are reaching out to Cincinnati to see if we can get a transfer to their hospital to have the GI motility specialist consulted on. There's a couple of things that I've been researching, and I don't know if anyone has heard of any of these things, but one of them is hyaluronic Botox injections, which is something that they would do there. And because with Theo, what our issues is, there's nothing mechanically wrong. They've done x-rays and there's nothing mechanically obstructing his gut, or his bowels. So we're thinking it's a neuro issue, like his brain is sending wrong signals to his bowels, so they're not emptying out. So this is, I don't know all the research on it, so I'm sorry. I'm still learning, but it's supposed to help with that part of it. So really, we're kind of at a standstill with Theo right now. He can stay on TPN and lipids. The only problem is the more infections he gets, the more places they have, or the less places they have to place the lines. So that's the complication we will run into eventually. So we're trying to get some steps ahead of it.
Can I throw that out to the families then at this stage? So
yes,
has anybody heard of the medication that Kayla has just spoken about that possibly affects the neurology side of the gastrointestinal issues, which I think, Kayla, is quite, from my experience with Jude, we looked a lot and spent a long time looking at, was there a mechanical issue? was there an obstruction in his bowel? Was there some physical reason? Was there a tumor? But the conclusion, I think, really for us, and it sounds like it's similar for you, is that it is something to do with the brain, and in which case perhaps then people may have found if seizures are slightly better controlled, is gut motility slightly better. Do any of the families on the call have any experience with that? Oh, I can see Nula's got her hand raised. Go on then, Nula, would you like to explain or share your experience?
Thank you. And thank you so much, Kayla, for sharing that with us. It must be really difficult at the moment. So we haven't tried that medication, but when Ophelia was younger, we used to have awful problems with projectile, really violent vomiting. And when you talked about the noises, I think it was you, maybe Emma, who said that, like the noises when they vomit, like there's so much like abdominal contraction and this awful noise, and the whole body is jerking as they're trying to vomit. And she used to do that a lot and just vomit literally out of nowhere. Couldn't tolerate bolus feeding. So we've had Ophelia on slow continuous pump feeding virtually 24 hours a day, because if we give her too much volume, without a doubt she will vomit. We have been down the road of, the was she lactose intolerant, so we tried the Neocate and all of those sort of dairy-free milks. That didn't really make any difference. The minute we placed a G tube versus the nasogastric tube, so she had nasogastric probably from about 10 to 12 weeks old. Prior to that, we were just, struggling to feed her and she was failing to thrive. Once she had the NG tube, things improved, but she would still do that awful vomiting. Once we placed the nasogastric, the vomiting improved, but we elected not to have the fundoplication done because of this violent vomiting, which we thought was neurological and that she would just rip it open, essentially. I don't know, did Theo have a fundoplication where they tighten the top of the stomach?
I've never heard of that. So
I think there is a
don't think
family
he has.
whose child has had that, isn't there, on the group? Is it Ida?
Possibly. It's
She does
often what they will do routinely when they place a G tube, at least in the UK, and we were in Switzerland at the time, and it was to try and prevent the vomiting and prevent the reflux. So the reflux being more like just the passive movement of milk, where it would just come up and come out of her nose, but without that violent abdominal crunching that she would do. And she would get very red, just like you explained. And I do think it's probably some kind of neurological, almost like storming, as they're getting these impulses to the gut. She would get horribly painful and constipated too. Probably not very much help, but I definitely think it's improved as she's got older. That doesn't help you right now, because when you're in the thick of it, it's awful, absolutely awful. But as she has got older, whether there is some kind of maturation of the, very delayed, but some development or maturation of the nervous system to the gut, it has improved. We still struggle. She has to still be on slow continuous feeding.
It's disruptive, the slow continuous feeding to family and normal life.
Yeah.
I found that quite difficult to come to terms with, that was where we were at. But obviously if it was the best for Jude, then that was where we were. Did you have a question? Did you want to contribute, Damaris? I know you had your hand up.
Oh, sorry. I just want to mention that Sadie had the fundoplication procedure that you guys were mentioning. I wasn't aware of it, but at the time that she was going to get her G2 place, which was when she was around 7 days old, the surgeon actually brought it up, and he said, based on all of her symptoms, and we're not sure, of what the future is going to hold for her, he definitely recommended, as Nola said, to prevent the reflex and the vomiting, and potentially what they were more concerned at that time was the aspiration. You know, she has silent aspiration. So at the time of vomiting, many of our kids unfortunately aspirate. And then not only going through the GI issues at that moment, but end up and turning into respiratory illness, possible pneumonia because of the aspiration. So at the same, she had both procedures at the same time. They closed the top of the esophagus, and so she cannot burp and she won't throw up. She's still, when she had issues at the beginning, she's still getting those rushing and gagging episodes, and I call it like make her tube throw up, what is bent in it, and you know, like when you bend and you get the residuals or the extra air. Well, at that time she just make it the same concept of vomiting but through the tube, so it just project.
Okay, I see.
Which was good because she's still getting, you know, get rid of whatever wasn't digest without the risk of aspiration and choking and all of that involved.
Yeah. No, that's helpful to know. Thank you, Damaris. So I think we all touched a little bit in there on some of the other issues that then arise, unfortunately, either from birth or as our children seem to grow a little bit older. And moving on then to discuss a little bit about some of the bowel habits, and my specialist subject seems to be poop sometimes on these discussions. But yeah, I just wanted to talk a little bit about the same. Similarly with the reflux, for us, I think there was a development of the bowel issues for Jude as he got older. Initially he seemed to be passing stools reasonably well, and there wasn't too much of an issue. But as he got older, and with hindsight, I think I've identified that when the gastrostomy was placed, his volume of feed that he was able to receive massively increased, and therefore the problems within the gut passing the stools seemed to increase at the same time. So we went from having a relatively easy time, I would say, compared to what we had towards the end of his life in terms of passing stools. So we really struggled to do a poo. Really struggled to get any trapped gas out of the bowel, which was almost worse than passing stools for us. As Kayla said, when Theo's tummy became massively swollen, the same situation was with Jude as well. And we had times when I can't believe the size of his stomach compared to what a little child he was with all of the trapped gas. And again, the impact of that on us as a family and for Jude was huge. He was extremely uncomfortable and would just be red in the face, screaming, waving his arms around with his big swollen belly. I can vividly recall my husband having Jude lying on the side and pumping one of Jude's legs up and down like this, patting him on the bottom, just trying to release this wind that was just trapped in the gut. When he had x-rays, it was very clear that there were large distended loops of bowel on the x-ray, and it wasn't feces, it was gas and it was wind. This made it difficult to go out anywhere with him, to do anything, because he would either be extremely uncomfortable or then have a huge explosive bowel movement in a nice quiet cafe when everybody was silently eating their dinner. Jude would explode, and it would be really distressing for everybody. Some of the treatments that we looked at, we tried all sorts of laxatives and suppositories. I think probably tried everything that there was, down to more holistic things like baby massage, peppermint oil. We tried that, putting that into his gastrostomy. But eventually, one of the only things that seemed to bring any relief was when we started to do a bowel washout using a saline solution that we inserted what's called a rectus tube, which went into Jude's rectum, and with a syringe on one end and a small amount of saline fluid was then poured down into the tube. It went around into Jude's bowel, and then using gravity, The saline fluid would then drain out if we had it at a lower level to where Jude was. And with that came all of the gas and all of the stools. It was a very messy job at times, and very time consuming and arduous. Myself and my husband had to be trained to do this. We then had different nurses who were looking after Jude, and if he ever went into hospice respite care, they also had to be trained how to do it. But his stomach would go from a big, massive balloon literally to nice, flat abdominals within about 10 minutes. And we ended up having to do that once a week. Once a day for Jude in the end, because that seemed to be the only way that we were able to get any relief. So again, I'd be interested to know, when did you notice the onset of any symptoms in your children with SGS? And what do you think, what have you been advised might have caused that? And how do you manage those symptoms? I can see Kayla's got a hand up. Yes, Kayla.
Yes, so that is something we've noticed with Theo in the last month as well. His ostomy output has decreased significantly. I mean, from in a 12 to 24-hour period, we would get between 200 to 400 mLs. And now we're down to like 5 mLs in a 24-hour period.
Okay.
So they actually have started irrigating his stoma. And I mean, he'll get, this is a little gross, but it's like mucus plugs of stool coming out of his that are just stopped up. And they did a test on him in upper GI with contrast. And it did show he had delayed emptying. So I think at 16 hours, the contrast was still sitting in there. And so we're starting to try to irrigate him every 4 to 5 days. Because along with irrigation, I mean, the more you do it, this is what they told me this week, the more bacteria can be, put into his stoma. So there's a risk there. So they don't want us to do it every day. But if, we're 3 to 4 days and we're not having much output, that's when, the benefit outweighs the risk. And so that is something we are starting to do with him. He's had it, I think, 2 or 3 times now in the last week. So
is it a difficult thing to do through the stoma? Does that, it obviously needs to be sterile, which makes it even more difficult, doesn't it?
Yeah. So I haven't done it personally. I told them, this might be my line. So, but the nurses and the surgeons will come in and do it. It looks like a lot to me, but I obviously haven't done it. So I know that if I did it, it would be fine. But yeah. But we're trying to figure this out because he never had this issue before. It's like all of a sudden his gut just stopped working. And we don't know if it's like been slowly leading up to this over the last year. Every time he got sick, a little bit more at a time, we were working harder to get him to tolerate. And we actually even tried through the J tube, just, 2 to 5 mLs over an hour of formula or a Pedialyte, and he can't tolerate that. So
possibly there's been some setbacks when he's had infections then, and it seems to have got worse.
Yeah.
Yeah.
And we have tried lactulose one time, and maybe there's some other ones that are better, but that one, I mean, it definitely worked, but it almost worked too well, to where he lost too much.
It's a balance, isn't it? I think with a lot of the medications, I found that with the medications for saliva control as well, it's some days it's not the same dose every day, doesn't work. It seems to change depending on so many factors, which is why I think this issue of gastrointestinal problems with our SGS children is so difficult. It's very individual. There doesn't seem to be one size fits all with treatment. It's perhaps going to be a case of more making clinicians aware of the problems which our children may encounter, and maybe coming armed with a list of possible things that we can try to see what out of that list might help our child on any given day, really, which makes it very difficult. Just looking in our chat, I'm noticing a comment from Anna. Thank you, Anna. She was just noting some exercises which she's found really helpful with Mikolaj, her child, and she's seen somebody called Dr. Mazgutov, who lives in the USA. I don't know if you've heard of this person, Kayla.
No, I
in an
haven't.
institute in Orlando, saying that during the rehab, he did some exercises during the rehabilitation stay, and Mikolaj's eating really seemed to improve to the point where he wasn't actually using a gastrostomy anymore, which is great. And once those exercises have, the frequency of which they were doing those has been reduced, she's noticed that Mikolaj's digestion has become worse and his reflux has become worse, but really saying the same as we all have, that it causes enormous pain and distress for our children, which is really upsetting. You just, as a parent, and particularly as a mother, one of your main roles is to feed your child, isn't it, and to care for them. But the most basic mothering instinct is challenged when we have these issues. Yeah. Also, Anna's mentioned another doctor, Dr. Svetlana Mazgutova. Yeah, that's the same lady again. So massaging on the belly, yeah, that's something like I was saying about pumping the leg, a lot of massaging through the bowel to try to get it moving. It seems to be quite static, and ensuring good hydration with all of the children can help to make sure bowel movements pass through. Does anybody have any other experiences or any instant things that they used which might have helped their child, particularly with constipation? Nuala, have you? I know you're like a poo specialist like me. What have you been doing with Ophelia?
I have 13 years now of poo. Poo dealing. We also use a bowel washout. I think that really does help, and we use something called a Erie pump, which is a type of device made by B. Braun. So if that would be worth looking up, it works really well. And you just instill, warm tap water into the rectum, and I think it is the distension of that just really seems to stimulate everything coming out, because Ophelia could go for well over a week and do nothing. And when we talk about constipation, it's not because the bowel movements are hard, they're just not moving. So they're just sat there in these loops of gut, and when they come out, obviously, at least for Ophelia, they're very loose, but she just has real problems with motility. The other medications or medication that we found really helped her was something called sodium picosulfate. In the UK, it's called Dulcolax. It might be called something else. You can buy it over the counter, but we found that really helped with the motility. And again, you sort of titrate it to effect. That was prescribed for her. And we use prescription probiotics every day. So she's on something called VSL number 3. And I think that really does help her. We used to give it as and when, because she would take a lot of antibiotics for her chest infections and urinary infections, and then we would have copious diarrhea afterwards, and then would run into problems with hydration. But since having her on daily probiotics, we still get an upset stomach with the antibiotics, but it's definitely better and more manageable.
Okay, that's interesting. Yeah, probiotics, I think I'm hoping that Karina and Christy and Damaris, that's something that they might be able to add into their discussions Bethany's just asked the name of that probiotic, Nuala, if you don't mind sharing.
Oh yeah, it's called VSL number 3. I'll put it in the chat. And I think you can buy it. I've looked on Amazon, it's quite expensive, but you can also get it prescribed.
Anything helps, really. It's marginal gains for us and our children, and that's why platforms like this are so important, because there may just be one thing that another family is doing or has done or needs to know, and you know that information, and that might be the thing that helps that family and that child. And that's why we're so grateful for families joining today and sharing their experiences with us. Does anybody else have anything they'd like to share on the topic of the gastrointestinal issues whilst we're in the talk before we move on to Karina's session?
There's another comment in the chat, Emma, from our Russian family.
Okay, so we use glycerin enemas from China. Yes, I think that's something that we tried with Jude as well. I think they can help to lubricate to try to get the stools to come out. So yeah, that is something, if families are struggling, that might be something that they'd like to try.
I think it's not letting me raise my hand. I don't know what's going on.
Oh, okay.
Yeah, but we have to use glycerin suppositories. So we just have to use the liquid though, because she doesn't really dissolve the like bullets.
Okay.
But any kind of like oral, well, through the G tube, any kind of laxative, it makes her throw up.
Oh, that's interesting.
We've tried Miralax multiple times, just a half cup full, and she really doesn't tolerate anything that stimulates her stomach. Is just her, she has so much pain in her stomach already.
That's the thing. I think
the vomiting that everybody, the horrible sounds when she vomits, and her face turns really red. And yeah, she has constipation, but it's always really loose when it comes out. So
yeah,
now we're getting away with liquid suppositories, but I'm sure that might change down the road.
I think some of the laxative things, like we use something called Movicol or Laxido, which is like a sachet, but that then creates a lot of wind and gas in the gut. So you end up treating one thing, but then it causes a problem further down the line, and that then is difficult as well, isn't it?
Yeah, so we have to do those twice a day, in the morning and at night, because if she tries to go between those times, she just vomits.
Okay, yeah, and that's just as distressing. Let me
sometimes even just trying to pass gas. So
Kayla?
I'm just having a look in the chat, just bear with me.
Yeah, Emma, Eleonora has her hand raised as well.
Oh,
so
yeah,
maybe she can
lovely.
ask Mauro or the Italian interpreter, or João.
Yep, go ahead, Eleonora.
Ok, io volevo portare la mia esperienza. Noi, anche Elisa, quando era piccola, abbiamo avuto grossi problemi di reflusso. Anche lei, quando era proprio neonata, vomitava. Però poi dopo, piano piano abbiamo notato con la crescita che è migliorata tantissimo. Abbiamo provato di tutto anche noi, cambiare latte, antirigurgito, e piano piano è migliorata. Non abbiamo fatto niente di particolare, perché poi con la crescita appunto è migliorata. Però l'unica cosa di medicinali è anche noi il Gaviscon, Peridon, e poi omeprazolo con la crescita, però adesso questo medicinale qua, l'omeprazolo, il Lucen, in Italia si chiama Lucen, non so da voi come si chiama, è migliorata comunque. Adesso va più a periodi, ecco, il suo reflusso, ogni tanto va meglio e ogni tanto un po' più forte. Però davvero ho notato anch'io con la crescita, non so come mai è migliorata. Sarà davvero magari un fattore neurologico che si deve, magari il corpo crescendo migliora. Poi una cosa però che abbiamo passato Non so se a qualcuno è successo, una cosa proprio brutta che gli è successo a mia figlia, che ha rischiato di morire. Gli si è girato lo stomaco e ha avuto un blocco intestinale. Siamo stati in ospedale 1 mese e mezzo, quindi ha avuto, cioè non riusciva più, è stata operata appunto, perché non si poteva alimentare, ha fatto, non so come si chiama in termine medico, la centrale venosa per essere alimentata via vena. Poi aveva il sondino, poi dopodiché quando è stata operata ha fatto la gastrostomia, perché si doveva di nuovo alimentare piano piano come un neonato, perché doveva riabituare tutto lo stomaco, perché non poteva alimentarsi. Però devo dire che col tempo poi la situazione è migliorata e niente, ha ripreso a mangiare via bocca, sempre tutto frullato, perché lei non mastica, sempre tutto frullato. E era sempre sottopeso, sempre problemi di reflusso, però erano migliorati. Poi gli è stata tolta la gastrostomia, perché comunque era migliorata. Cioè, diciamo che è stata messa solo nel momento in cui ha rischiato di morire, ecco, perché lei ha sempre mangiato via bocca. Però problemi anche noi abbiamo problemi anche di costipazione. Infatti anche noi facciamo, perché comunque poi col tempo ha avuto anche vari ricoveri per rallentamento intestinale, però poi si è risolto spontaneamente. E facciamo anche noi ogni tanto la sonda che ci hanno fatto vedere, ma che alla fine poi abbiamo fatto noi genitori, con anche noi acqua tiepida e sale e l'irrigazione intestinale in pratica sarebbe. E con quello li pulisce bene l'intestino e va. Poi però devo dire che non so se sono fortunato o cosa, col Movicol. Noi col Movicol mia figlia va da sola, almeno, non so, si vede che ho beccato la soluzione giusta per lei, non so, devo dire che sta andando bene. Poi vabbè, ci sono dei periodi che magari non fa da sola, allora l'aiuto con
Thank you.
gli stedi e queste cose qua. E niente, basta.
Thank you, Eleonora. That's really interesting for sharing your experiences. And I think it's very illustrative that things seem to be very different for different children. And it seems to be there is a pattern. Oh, hold on 1 second. Apologies, it's saying I've switched to Italian.
We can hear you still.
Okay, good, right, just saving. It seems to be that the reflux and the vomiting issues are perhaps slightly worse as the children are younger, and then they tend to seem to improve, but then the bowel and the constipation and the trapped gas becomes worse perhaps as the children get older. That's perhaps a bit of a rudimentary summary from some of the discussions today. Just having another look in our chat. Rumi was just asking, there we go, how things progress with digestive problems, and it seems to be a trend that as they get older that seems to be worse, but again it really does depend on your child and perhaps the method by which they're fed. So yeah, no, that's really good. Does anybody have anything else that they'd like to talk about?
Christy wanted to say something.
Yeah.
Okay, can you guys hear me and see me?
We
okay?
can. Hi, Christy.
Hi, I wanted to touch just on that because, you know, listening to you guys, I can relate a lot. My daughter has a severe traumatic brain injury. So although she moves to a point, mobility and bathroom issues have been pretty severe. As you said, she's actually changed quite a bit, but she used to have the same problems where she would severely vomit. I would be holding her, really bad times. But I noticed some people kind of saying like, we tried a probiotic. Oh, you can't hear me?
No, we
Yes.
can hear you. Yeah.
Okay.
Okay.
I noticed some people kind of said like maybe they tried a probiotic and it stopped working or it didn't work and now they have to try something else. But, you know, a big piece to that I've learned from some of my kind of like functional neurology friends who study more of the root cause of why that might be. A lot of times if you stick, is my language studying in English?
No, I think it
Oh.
it may be Kayla just needs to check that hers is English. I can hear you okay.
So sometimes I looked into this myself because I kind of like went on Amazon and I'm like, let me buy some probiotics to help. But at the time I didn't realize that sometimes if you stick to like one probiotic or one brand, you can kind of introduce too much of that good gut bacteria and it can actually cause adverse reactions because the gut likes diversity. So probiotics are great, but sometimes it's better to do them in moderation or to not use the same strain, or you could just be using a strain that's not right for your child. All the strains do different things. And so sometimes I see people are like, oh, I tried this. When my daughter was on probiotics, she had the most UTIs I actually ever saw. And it took me a while to learn the connections, but I just wanted to add that another source to that I would really encourage people to look into is one, I'll have to say this because I understand parents, the doctors do prescribe PEG Miralax, but I would just advise you to kind of look into some of the research because although PEG is, it's actually not FDA approved for children. It's actually not approved to be given to children, even though it is, but there's some scary side effects to PEG. There's a group called Parents Against Miralax, and it's founded by parents like us whose children developed a seizure disorder directly from the ingredients in PEG. So I just want to put a caution out there that if PEG isn't working for someone, I would encourage you to look into natural probiotics, and they can be given through the tube even if you're not on a whole food blended diet. You can still kind of find a way to like even sauerkraut or pickled beet juice, you could give through the tube. 1 tablespoon is studied to have more probiotics than a supplement. So I just wanted to encourage people if they are struggling, that's been like the #1 thing to help my daughter without any side effects is she wouldn't go and I would give her natural probiotics through food and she would clear her bowels that day right away without any pain. So that's been something that I have to recommend because it's just been like life-changing for my daughter with her bowels. And I do believe it all has to do with bringing gut bacteria into the gut because certain things kill gut bacteria. It's studied. It can be sugar, oil, medications do. Many medications actually kind of like antibiotics. They'll kill all the bad stuff. They kill all the good stuff for 6 months. So a lot of people will see kind of some adverse reactions and don't realize that if you can just find ways to increase the gut bacteria back up so it can fight off the bad stuff, it's really, really successful for people in my group.
And our children are often on repeated courses of antibiotics, some prophylaxis for UTIs, but from my own experience, chest infection, constant antibiotics. So that's really interesting. That probably actually brings us very nicely to move forward to discuss a little bit more in detail the blended diet. So I'd just like to thank Kayla particularly for her input into our discussion. Her little boy Theo is obviously a handful, isn't he, Kayla? And we really do appreciate you making the time to come and share some of your experiences with us today. And thank you ever so much. It's been really helpful to hear from you and from all of our families. And I hope that there's some things today that might be able to benefit Theo.
Yes, thank you so much. I really appreciate it.
I will hand over to Karina now, who is one of our SGS trustees and mother to the other Emma, little Emma. Thank you very much, everybody.
Thank you. Hello, everybody. I hope that you can hear me just fine. I am Karina and I am Emma's mom. We will be talking, myself, Damaris, and Christy will be talking about blended diet and how we got started and the whole journey regarding the blended diet. Yeah, Damaris will go first and then I'll follow, and then Christy will be in the end, and then we'll do the questions as well. So yeah, and also just feel free to ask questions in the chat, but we'll start by sharing our experiences, and then Christy will continue with her great knowledge. Thank you. Damaris, over to you.
Hi, everyone. So my name is Damaris. We live in the USA, and I'm mom of Sadie. I want to share a little bit of our experience with blend diet and how we started. I make a very simple presentation, and I want to try to share my screen. If you can please let me know if you can see it. Sorry about the technical difficulties. Can you see my screen now?
No, not for now.
No, not at the moment.
Okay.
Let me just make sure. Hold on just a second. Let me make sure that you okay, you are co-host, so you should be able to share your screen.
Okay. Can you guys see it now?
We're starting to see it.
Yes,
Yeah.
perfect.
Okay, well, let's see if I can share the whole screen.
Perfect.
Can you see it?
Yeah.
Okay, thank you. It's very simple, but I love visual, and it's also a good guide for myself, so I don't get lost in on my story. I will try to make be as direct as possible and don't get to extend on any point, but okay, so now, okay, there we go. Sorry about that. So those are just some pictures of how I cook for my daughter. It definitely was a process. I didn't know how to start, and I started in a very simple way, more like a making baby type of food for my kid, more like a puree. And these are some of the most recent way that I cook for her that I find that that I have now I have a good system, and I'm still learning a lot about how to choose the right ingredients based on her needs and tolerance. But this is what I want to talk about. I want to give you guys a little bit of what Sadie's story looks like on blend diet, and very briefly talk about the disadvantage we have always suffered from commercial enteral formula nutrition, and of course the benefits of blend diet. Like some of us, we have said before, this is our kids share a syndrome, but they're all very unique. So by any means, I'm trying to recommend anything or blame anything to anyone. I'm just exposing what have worked for us and what haven't. And I hope I'm not offending anyone. But Sadie, have a rough start like all of our kids. She was having issues with feeding since she was born. She ended with a G2 place when she was around 7 days old after she had a complete malrotation where her intestines flipped completely. They have to reposition her appendix. When they reposition that, her intestines and her stomach, and after that she ended up with a G tube, and since then she's been 100% G tube fed. These are 2 points that means a lot to me, and that's how we start our journey with blend diet. I believe that it's my right to choose the type of nutrition for my child, and I believe that my child has the right to access to the best possible nutrition. Sadie didn't start blend diet until she was over a little bit over 3 years old, and the way we started actually came from a really bad experience. Those 3 first years of life was struggle with GI issues and feeding issues. It came to my mind and to my knowledge that blend diet could be an option for her. But when talking about 7-8 years ago, back then I didn't have the support from her doctors, nutritionist, dietitian. Everybody called me I was crazy for wanting to complicate my life blending for my daughter when I can just stick to a prescription, insurance will cover her nutrition, and I wouldn't have to worry about nothing by unscrew the lid of a bottle and put it through a feeding pump. And nobody hear me, nobody believe her issues could be related to her diet until that time. And it seems like unrelated, but we were on an appointment with an orthopedics because we found out she had a hip dysplasia. And during the appointment, the doctor didn't want to see her x-rays or anything, didn't want to talk about possible treatments or surgery. I was told what to bother if my child was going to die anyways. And she told me she will never perform a surgery on a kid with a terminal illness. And all that I asked was, I just need to know what I can do and what I should avoid related to PT and how to position her, how to move it around. And she told me very straightforward. She said, that's your child. Take it home and do whatever you want to do with her. I don't care if you try to stand her up, if you put it in a walker, if you leave it on her bed 24/7. Do whatever you want to do. That's your child. So I left the appointment with a heartbreak. And after I passed my frustration point, I think that's one of the best advices I have ever received by anyone. Her words are still going around my head at this time when she said, "Is your child, do whatever you want to do." And you know what? She was so right. She is my child, and that's what it comes to me, the point of I have control about this. I have control and the right and the responsibility to choose what is best for her. So at that time, we have nurses, and I have tried multiple times to start blend diet by myself. And we couldn't because we need an order from a doctor. The doctor told me I can go into legal stuff if I feed her something without an authorization. But after the doctor's advice, I had enough, and I ended up with the director of the hospital, and I got the paper signed, and I start my journey to blend the diet by myself, just by my husband and myself. So it felt like it gave me that control that I needed, that I should have since she was born. But anyways, that's how we started. So for me, providing excellent nutrition is a parent responsibility. It is my responsibility to provide her with the best possible nutrition. And to me, blending is an act of love and commitment. That's my way to show her, you know, how much we care and how much we're willing to do. Like I said, it's not easy. Now it's become a part of us, and blending is not a big deal. It's something that we can accomplish and something that we can do easily. But it has been a process, and it definitely was difficult at the beginning. But to me, it's like I said, it's a commitment and an act of love. That comes from my husband. When Sadie was born, I have a very difficult delivery, and she came, and her color was purple, and she was barely breathing. And my husband told her, if you breathe, Sadie, if you fight, we will always fight with you. And blending is one of our promises to her, that as long as she keep fighting, we will, keep fighting for her. But these are some of the negative side effects that we were experiencing. Back then, I didn't completely put it through being part of a diet issue. All that I keep hearing was your daughter syndrome, and she's probably gonna pass anytime soon, and people with her condition that doesn't make it this far. That's all that I keep hearing over and over from her medical team, for most of them. But I was, we were experiencing what everybody was mentioning, the gagging, the vomiting through the tube, the retching. Back then, they put it on a Reglan medication to try to control the gagging and those issues, and she had a horrible side effects. She was well controlled with seizures back then, and then her seizures started out of nowhere, and end up being a direct side effect from Reglan. And this is not from me. This is from their neurologist and the lab testing that she had done, and they checked the levels of the medication, and just Reglan is now in her medical file as a seizure allergic reaction. So everything that we were trying to do to help her was just making everything worse. She wasn't thriving. She had poor absorption of nutrients. Her weight was all over the place. She either was gaining weight too fast or losing weight too fast. She didn't have energy. She, was irritated all the time. Dehydration, constipation, and diarrhea was horrible. They keep switching formulas. They were choosing broken down protein formulas, increasing volume, decreasing volume, going into 24 hours continuous feedings, everything. And just, she just got worse and worse. Every time they would try something new, something to help her, it just make it worse. When we did the transition, the full transition, we start with one ingredient and we still went on formula. So we did, her regular feedings of formula and then add one ingredient. I believe we start with bananas, and then we stick with the same ingredient for 3 days. The transition was very, very slow. I was scared and afraid of allergies reactions to food reactions. So we went very, very slow, but we got to the point where get a good variety of nutrition, and that's when we start seeing the big change. Some of the benefits of blend diet, in general, all her her gastrointestinal health improve. She doesn't suffer of constipation or diarrhea anymore. She tolerates her feedings really well. She receives a variety of nutrition because we're not stuck with the same formula. So I rotate her proteins. There's not always chicken, or not always fish, or not always turkey. Same I do with grains and fruits and vegetables. So try to cover all the groups and switch it between, so she can get a nutritional variety. It is also such a nice way to have an inclusion. I wrote here about holiday meals for those that celebrate Thanksgiving is coming up. For our house or our home, is so nice to include her in that special meal, and whatever my husband and I cook, we separate and blend it for her and add her special ingredients like the turkey and sweet potatoes, and added to some of her special items, and it's so nice to feel her she's included in our family traditions, and it just gives us a sense of normality. It also reduced the hospital admissions. I know this is crazy, but the last time that she was hospitalized, it was on June of 2019, and that was a hospitalization for an orthopedics procedure, nothing related with GI or respiratory. The last time that she was before that hospitalized was May of 2016, and that was for a GI procedure. They did an endoscopy and colonoscopy trying to figure out the root of the issues, and like Kayla said, and some of you guys said, there are no mechanical signs of a specific explanation of what everything is happening. Most circle back to being a neurological issue. But to me, the fact that when her diet switched completely to a natural diet, her health issues just start disappearing one by one and one by one. And we were able to maintain a stability. She's stable. She still have her issues, like we all know, but she's stable. The fact that she haven't been in the hospital for years is huge for us. It's a huge difference. And I look back and I question myself what I have done different. What is different from when she was sick all the time? And in my opinion, my experience is the diet, the synthetic nutrition, the synthetic supplements and medications that I haven't been able to treat it and address those issues with the diet. She was on an iron and potassium supplements that at this day I'm able to maintain those levels where it should be just with diet. Her potassium was, the potassium that's prescribed at the hospital, at the doctor says it's a synthetic a supplement, which is harder for the body to absorb. I'm just make sure she has a banana every day and add other ingredients like the chia seed and spinach and things like that. They are high on potassium, and her levels are beautiful for years. Same thing happened with the iron. So for us, a diet not only have help with her GI and nutrition aspects, but also her overall health. Here's some just pictures. I love taking pictures. I love the colors of natural ingredients. We stick to organic as much as we can. On the top right picture is a drink that we do on summer days when it's hot and we want to keep hydration levels where it should be, instead of doing Pedialyte or another stuff that we would recommend at the beginning. This is a great way to maintain her hydration. It's just a lime, salt, and watermelon, and it do wonders for her. On the bottom is a papaya drink that helps with constipation, keep everything moving. On the right side is a pineapple blend, which increase the urine output. We do this every time that we start seeing signs of UTI. It helps wash her kidneys and move everything nice. And I come now to a good system. Like I said, it didn't look this beautiful at the beginning, and I used to make huge messes in my kitchen. Now it seems like everything is more organized. I keep everything in glass bottles. I blend every day, and I usually make a little extra and freeze at least one bottle. And those I have in there for emergencies, long days at the hospital, if I get sick or something gets out of control, too busy of a day, I always have something blend for her ready to just get it out of the freezer and serve it to her. I think I come to the point that I cannot go into her brain and perform a surgery and fix her genes and reverse her syndrome, but I do have control about her nutrition, and her nutrition can definitely impact and improve her health. So that's how I think, how I see things based on her progression and her and the benefit that she has had through blend diet.
Thank you so much, Damaris.
Thank you.
I have just a little something to add, really. I think our stories are quite similar. For those of you who don't know, I'm the mom of Emma, and she passed away, unfortunately, in the summer. And of course, we miss her like crazy. But we have very similar experiences with blended diet, as Damaris was talking about. Emma would throw up constantly from she was around, I think it started already before she was 6 months, but she got her G-tube or Mickey tube placed when she was 6 months. And then we were kind of hoping for everything to get in order, but she would just throw up. And we got her on the formula, and it just didn't get better. And at one point, I think she was around 2 years old, I just couldn't take it anymore. The constant vomiting, the reflux, the gut issues. So it was really from one day to another. And I wish, Damaris, that I had your patience, I guess, because I just switched her from one day to the other, which of course it was a mess, because then she threw up because we changed her too quickly from formula to a blended diet. But we have a very similar experience that as soon as we got her to a blended, more natural diet, I'd say, the vomiting stopped, the reflux stopped. And I want to give the same disclaimer that this is just my personal experiences as a parent, and I'm not really I'm not judging anyone for choosing a formula diet over a blended diet. Really, that's very important for me to say, but I just really want to highlight our experiences with blended diet, because it was really a big benefit for Emma that we did that switch for her, really. So since she was 4 and since she was 2 and until she passed away this summer, we did a blended diet for her, which was mainly chicken, turkey, fish, and then lots of vegetables, pumpkin seeds, chia seeds, oils. And then I was afraid that the calories would be high enough for her, because she couldn't absorb the same kind of volume like a more neurotypical child would, but we used coconut milk for a base and also almond milk instead of water. And then we didn't strain the puree or the blended food. It just requires a really powerful blender really to turn it into some like a soup kind of consistency. Yeah, so I think I can really relate to what you're saying, Damaris, about Sadie and your whole journey. And I will be heading over to Christy for now because I think your points of views are really important. I want to give you a little bit of advertising, I think, because when I first started my blended diet journey, I actually found your group on Facebook and also a Danish variant of it. So I want to give you a little bit of credit for that as well before you start telling about the amazing experiences that you have. But Christy, the word is yours.
Okay, thank you. So can you hear me? Just want to check. Okay, so I could tell my story, but it's almost back to back with the stories I've heard today. My daughter's a little different, but has very similar stories. So she had a severe traumatic brain injury when she was 1 year old. So I was not always, the stance I hold with you today was not always my stance. I was thrown into the medical world, so to say. We all go to doctor's appointments, but until you're thrown into the medical world where you have to have them control like everything about your life, it's totally different. So my daughter was put on a feeding tube pretty fast after her brain injury because she had a seizure and she couldn't swallow. Swallowing's really hard for her. So she was kind of like in a coma-like state just for a little bit, but she was basically, they didn't really ask me or say because of her condition. They were just like, she's on a feeding tube and she's on formula. They didn't ask me which one I wanted or any choices, kind of like when you give birth at the hospital, you know, you get like a menu and you get to pick. Well, they're just put on a formula. That was my routine. So for about, I want to say a good year, I just did what the doctors told me. I just basically said in my head, these symptoms that she's having is because of her brain injury. This is how it's going to be. So she was throwing up constantly. She could not catch a break. And then the doctors kind of get mad at you because you get failure to thrive. And they don't exactly say, maybe we should change the medication, but they want their weight to be up. So I think it was a really stressful time for me because I felt like, what am I doing wrong? I'm doing what I'm told, but my daughter just cannot catch a break. So we came to a blended diet because moms on Facebook were saying this changed their lives, and we started looking into it. And when I created Blending Hope, I created my community online coming from a place of, I understand that you don't always get support and help. I went to a dietitian appointment with 4 nutritionists, and I wanted to start a blended diet. And kind of like the other speakers have stated, they kind of looked at me like, why would you want to do that? We don't help with that. You're going to face a lot of problems. So I understand all of that. And when we started switching to a blended diet, again, we saw so many improvements that we didn't think were possible. So my daughter started sleeping all night. She started moving more. You can actually kind of see the healing in her eyes. When we talk about why should you switch to a real food blended diet, I totally agree that this isn't medical advice. I am a huge advocate of it because I do believe it can work for everybody. And I believe that there's certain reasons why some people might fail that they're just not aware of. So formulas in the box, you know, we can go from Nestle Complete to Nutrigen. They are synthetic minerals and vitamins, meaning that it's not found in nature. It's kind of created in a lab, which sounds great on paper. But the problem with, my main problem with it is when you have a list of added vitamins that are synthetic, it's known in studies that they cancel each other out. So if you're taking a formula and it says calcium, and you're thinking, great, I have all the calcium I need today, synthetic calcium can actually cancel out synthetic magnesium or iron. And they don't exactly tell you this. So Medications also do that. So a huge part of my learning was that nutrition deficiencies are huge. I mean, low iron, I was suffering from low iron and I didn't know it. And I felt like I was going to die for a week. I was so dizzy and tired and lethargic. And I never would have dreamed that it all had to do with my low iron that no one was catching. So I just want to touch on nutrition deficiencies are huge. Magnesium controls over 300 body functions. So nutrients and all of that stuff is really important. What we recommend in my group at Blending Hope, because some of the feedback you might get is, well, how do I know if I start a blended diet that my kid will get all the nutrients? There are free phone apps for diet that you basically download on your phone. You actually can put in what ingredients you want to use. So I could say Tyson chicken, and it'll tell me exactly the macronutrient balance. And you build your meal and it tells you what you're receiving every day. So sometimes another part of just in my group is giving you ways to approach medical professionals where you can handle a lot of the macronutrients and making sure that you're receiving enough calories that way. So some of the benefits of like a real food blended diet that I truly believe. Another thing I want to say, have you guys seen like the movie Super Size Me with McDonald's? There's a nutrition who did this, and I actually wanted to do this. But if you took the formula that your kid might be receiving and you drank it every day for a week, she basically documented how it made her feel. And it was pretty eye-opening. It was very much like Super Size Me. She started feeling lethargic. And me and you both know that if you make leftovers, no one wants to eat it every day. You don't want to eat the same thing every day. But there's a science to that. Our body craves diversity. Our body does really well on diversity. And I believe truly from my daughter that our bodies are amazing. Our bodies can be broken and recover. And I truly believe that the brain also, when your child has a brain injury, kind of like how parents here are saying they weren't given much hope, they tell you however your child recovers after a year, that's final. So with my daughter, it was always basically, she is what she is. You don't need to do much more. You can let her lay around. That's absolutely not been my experience. I've seen her grow and I've seen her recover tremendously from the diet. And I think a lot of it has to do with the gut-brain axis. So I'll just touch on that briefly. I won't go into too much detail, but your gut is directly connected to your brain via a stem. And 80% of your immunity and emotions are dependent on your gut bacteria. That's why some people who have maybe antibiotics or low gut bacteria can seem depressed or can seem low on energy. And unfortunately, it's not a lot of thing that like doctors tell you, but it can be easily fixed. And the great thing about a blended diet is for like the children who are put on antibiotics, you can adjust the diet to what you need. So if your child needs more diversity, you can go home and give them fermented foods for a week. You can actually make it in your kitchen really, really cheap, no additives. And it's, they did some studies that showed it was like a 70% positive increase of emotional and depression went away when they were routinely give natural fermented foods. So again, it has to do with making your machine run right, because when you give your body the tools it needs, it will heal itself to a pretty tremendous point. I've met just a lot of professionals have made me change my mind. They call it unlearn, unthink, but you kind of relearn what you thought about recovery and nutrition, and a lot of it has to do with diet. So again, that's why it's a huge passion of mine. And in my group, we try to give some science-based evidence with studies, because I think that's important to show to your dietitian or hospital, but we also try to share a lot of just our real life experiences of moms of this has helped us. In my group, constipation and gut issues are #1 complaints, but it's really, it makes it worth your time when you see the parents just say, you know, this changed my kid's life, this changed my recovery. No, my children's not 100% healed, but this makes parents and kids' lives easier. You're not cleaning up throw up constantly, just like Sadie's mom had said, my child was in the hospital quite a bit, and now she just isn't, because most of her problems we can handle at home. So there's definitely, I think blended diet is, in my opinion, when we have kids like this, we all kind of want a magic pill. What can I do to make my kid better? Can I buy this supplement? Can I buy $200 worth of supplements? Can I go see this therapist? But if you really want to invest in something that daily can change your cells, change your gut bacteria, and shape your brain into a better way, food and nutrition is one of your most powerful tools. I truly believe that. And you know, I see it says storage and handling, and I know I touched on like the calculations through the app. The app definitely lets you control how many calories and nutrients you're getting. And storage and handling with the foods we have, I have a lot of guides in my group, but I'm willing to email or text them to anyone here who wants them. But we basically like to give you a visual of, if I'm going to start a blended diet, this is what I should get, this is what I need, and this is what I don't need, just to save people some shopping and money. Storage and handling, I see a lot of people using the mason jars, and I really recommend to investing in glass rather than plastic, because I know, you know, another thing I just want to touch on is the biggest, so the app name I mostly recommend is called Chronometer. It's CRONO meter. It's free and it calculates everything you need. And when I said that synthetic vitamins cancel each other out, natural vitamins and food do not do that. None of them do that. And you also typically don't overdose on natural vitamins. Like some people have vitamin D in their formula, and then they get a supplement that has vitamin D. That can cause a lot of issues, especially to the liver and kidneys. Synthetic vitamin D is something that just be really careful with, I want to add. So the storage and handling, we recommend mason jars, because there are studies that show that anytime you store liquid or food in plastic, it does put microplastics directly into your brain, which can affect kidneys, your organs, everything. So they're actually called PSFAs, which are forever plastic chemicals, meaning they don't degrade. So, and it's actually not more expensive. You can buy a pack of mason jars for $20 and reuse them, rather than filling up landfills of plastic that you have to throw away, that could be contributing to some of our health problems too. So when I talk about blended diets, it's not like you try to be better than anyone, saying you should be all organic or use glass, but there are a lot of health benefits to do that, and it doesn't even cost more money a lot of the times. So a big part of my teachings too is just teaching people how to blend, but kind of how to do it the right way, so you're not, we all want our kids to do the best they can, and I surely have seen many, many benefits from it. And working with medical professionals, I just want to touch on that, because most people who start a blended diet, I've heard a lot of people say they're worried about clogs, or worried about, usually they say you shouldn't do that because it clogs the studies. I will let you know that Dr. Terry Walls, she's a huge advocate for real food blended diets. I can send that to anyone who wants it, but she did do a very published study, and they did it on like 70 people in nursing homes, different NG tubes, when done correctly, which means you need the right blender. You can't just go in your kitchen and get like a $70 Ninja. It doesn't have a high enough blender seat, but when you do it the right way with a high enough blender, all the studies showed very successful, no blockages, there were no adverse reactions. So I do think it's kind of, it's not always like you're going to go to your doctor and they're going to be like, oh, that sounds great, you should do that. It's something that you got to listen to other moms and learn that it can be done, and kind of advocate for yourself.
Absolutely. I recognize that.
Yeah. And I don't think that it's so much that maybe doctors are against real food, but doctors, they typically stick to a certain protocol. So, some people might call it like an alternative therapy, or maybe a therapy that's more, but food heals you from the root cause. It can heal your conditions, where supplements and medications, although they're needed and they're life-saving, they do not solve any condition. They don't. It's not made to solve the root cause. It's made to manage your symptoms. But if you really want to get into healing, your body actually recreates new stomach cells. It recreates new brain cells every 3 months. So if you're going backwards right now and you start a blended diet, you can actually reverse those changes in studies within a few months, which is pretty amazing. And if anyone has any questions or wants any of the links to the guides or studies, I can email those to anyone.
Yeah.
So that's a great question, because I don't want people to go wrong with the blender. There's 2 brands that work always, any model. That's the Vitamix and the Blendtec. And they are expensive, but they have a high motor power that you need. Both offer refurnished units online. On Amazon, there's sales, and both offer medical discount programs. So if you go and you email them directly, they will give you a discount on those blenders. Now, if you have a cheaper blender, you can use it, but you're gonna have to cheesecloth each strain. So that involves like the metal strainer, getting the chunks out so it can go through. But again, it all has to do on your motor power to get it through the tube.
Absolutely. I'll just go through the chat real quick because there was a few comments. Just bear with me because I'm on the iPad. We had Camila saying that her daughter Eliza's diet was the same as Sadie, and that it's working really well. Thank you so much, Camila, for your comment. And I think she asked a question that she was about to ask about the kidneys within such a diet, and I hope we covered that. If we didn't, you can ask again, Anna. And then examples of a daily menu. Maybe we can collect that from Damaris, I, and Christy, and we can share that in the group. Just some ideas to what a menu for a few days could look like. And then, sorry?
I have some recipes I could actually give you that you could feel free just to give out, that have all the calories and everything on it, what it looks like. So use that as an example.
That would be really helpful. Thank you. We can just talk after Christy, and then you can share that with me. I can put it into the group maybe.
Yeah, that'd be perfect.
And then did we cover Anna's comment as well? I recommend looking for the MNRI method therapist in your area, specialists all over the world. I think that had something to do with the exercises that we talked about in the previous point with Emma and Kayla. And blended type. Okay, I think we're done here in the
I think
chat.
Eleonora previously asked Damaris if she could write example of daily menus, or maybe maybe Christy can share the link. We can share it in a private group with all of the parents.
Yeah. I think we should do that, definitely. I can see Damaris, you have your hand up, and Nula as well. Damaris, I'll just let you continue, and then Nula can carry on from there.
Thank you. Just really quick, I want to say we're still with the same dietitians and nutritionists, and actually the same pediatricians since the beginning. And those doctors that were against blend diet, and they weren't willing to support us at one point for any reason, are pro blend diet now. And I'm talking about, like I said, 7-8 years later. And it's all based on that results. Last time I just have a GI appointment And I saw that dietitian during the appointment a couple months ago, and she's still having regular labs, and of course they monitor her weight and everything. So in general, their comment was like, keep doing what you're doing. She looks amazing. It's great how she has improved, and they're all amazed of that there's no hospitalizations involved, and they're just pretty stable based on her severe condition, that she remains that stable. So now they put the value to her nutrition, and like I said, just said, keep doing what you're doing. It's amazing. She has an amazing result. So it's huge for us, you know.
Thank you. Nula, you have your hand up.
Yeah, thank you. Just very quickly, a question for Christian Demaris. I definitely wanted to take the plunge with Ophelia. I can't believe it's got to 13 years and we've still been sort of fiddling around with it, but I think sometimes you can get so overwhelmed with all the other stuff going on that it just feels like it's such a big step, and then there are all these doubts and not much support from dietitians. But I think, you know, I've played around a bit with it, but listening to you both, I'm really, you know, convinced now. And also, Karina, you're a strong advocate too, that we need to do this for her. And what you said, Christy, about the supersize me, you know, you can imagine maybe how some of these kids feel. It's awful, really, when you think about it like that. So I suppose my question is, for somebody like myself who has maybe overthought it and has been kind of teetering on the edge of like, I need to do this, but I don't know what to do. How do we get started? Do you think it's important to do what Damaris said, where we should start with one ingredient and give that for a period of time, then you add a second ingredient? Or do you think it doesn't need to be as gradual as that? Like what would you recommend?
That's a great question. And something that I'll touch on that I meant to is almost all the symptoms I hear about today, I encourage you to look into leaky gut syndrome. So it's something that's not talked about, but it's antibiotics, prescriptions, and commercial formulas all without a doubt cause leaky gut. So leaky gut is when you've been on, and even toxins, mold can cause leaky gut. So what happens is your gut has a barrier and it keeps all the toxins in. And when you kind of put things into your gut that is synthetic or your body doesn't like, it breaks. So you can actually have like stool, bad gut bacteria that go into your organs that aren't supposed to. So the reason I'm touching that is almost everybody who starts has leaky gut, but they don't know. So for that reason, it's probably going to always be beneficial to start with less ingredients, because less ingredients are always tolerated better than 10. So once the body starts receiving foods, it can kind of be like, I know what this is, but at first, it does need to be adjusted slowly. So I have like a beginner's guide in my group with recipes, but basically what I recommend, 1 to 3 ingredients max, and transitioning can take up to a full month. So it's not like it's just going to be set in a week. And it's important to use ingredients that aren't going to cause gas to help rebuild the gut lining. So homemade bone broth, number 1, collagen, vitamins, heals the gut, gives you protein, heals leaky gut tremendously. So that's something that, like, if you're starting, baby type foods to start. So if you think about baby foods, it's like chicken, apples, cinnamon. Those are all great suggestions. You don't want to start with beans and dairy and cheese because of the leaky gut. The gut's just going to blow up. Inflammation will make it. And I know a lot of the inflammation and the gut kind of blowing up, that actually is related directly to your kidney and liver health. So when it's overburdened, you'll see it inflammation in the gut. So there's actually a lot of natural ways you can heal that. Dandelion root, number 1, safe, no side effects. You can go in your backyard and make it. I do. I dig up the root and make dandelion tea, but it cures anemia it cures it actually helps the body produce more iron, and it heals the liver and kidney. So that's another really amazing tool that you can implement, really safe for most people. So I do recommend starting slow, and it's not going to be perfect at first. And the more you do it, the more you can introduce more things without a problem. But I would, if you are starting, there are certain ingredients you should start with and avoid to make the transition smoother.
And we could get hold of that information on your group, is that right?
Yep. And I could send, also I'm going to send you an email after we talk too, of just like all my guides that you can just
Super,
add.
thank you.
And I lay out kind of like, I have like 5 recipes that I've laid out that I would recommend to start with. And another thing to a benefit is, I don't think a lot of people touch on this either, but there are benefits to doing bolus feeds rather than 24/7 feeds. So a lot of kids can't handle a lot of volume. So they're put on 27 feeds. Now, the thing about that is the gut naturally wants to sleep at night. That's how we heal and detox. So another benefit to a blended diet is usually the gut can't handle bolus feeds because it's a lot of liquid, right? The formulas are a lot of liquid. When you get into real food, you can actually start doing bolus. And we were able to get to a point where we threw away the pump and she could sleep all night. That has known studied effects. Your body wants to heal at night and not eat so much. So that's another huge benefit that I think people find with volume tolerance and food. Yeah, so dandelion root, it's kind of hard to eat. So you can make a tea out of it. You can actually dig up the root and just boil it and make a tea. Or you can get a dandelion root tincture. So it'll only have like 2 ingredients. It can be alcohol free. You can get a glycerin one. And I just put it in my daughter's food or water. And that's something that cured my anemia. So I'll always be a huge advocate for dandelion root. And like I said, it's free. If you don't spray chemicals in your backyard, you can go make it yourself. And it actually also helps urinary support, because I just saw that in the question. Dandelion root can cure UTIs. UTIs are usually caused by too much acidity in the body. So the most time my daughter had UTIs was when she was on probiotics and synthetic vitamin C. And I didn't realize there was a connection. But ever since she stopped those 2, she's never had a UTI again in her life. So that's been really good, because a UTI, that's scary. I mean, I didn't know why I woke up and my daughter had a fever, and it looked awful. UTIs are scary.
Yeah. All right. Do we have any more questions? Did I miss anybody? Or otherwise, thank you so much, Christy. I will stay in contact with you for sure, because I can just sense in our little community here that blended diet is something that people are really interested in. And thank you so much for wanting to spend time with us here on this Sunday. It means a lot to us. Thank you.
Oh, I thank you for inviting me. It's truly life-changing. It really is. So I encourage everyone, even if you can only do a blended meal once a week, even if you don't want to fully take it over, if you can give your kid once a week just a blended smoothie, I think it's amazing for their health, and amazing for the moms to get comfortable with it too.
Yeah, absolutely. I can recognize.
Yeah.
I'll head over to Alexandra. Thank you so much, both of you, Damaris and Christy.
Thank you, everybody. Thank you, Christy. This was very helpful. We will looking forward to your links and to learn more about everything that you did and building your community. Really true sounds amazing for every kid on this planet. So thank you for everything and for advocating for our kids as well. Well, I believe we are out of time. Dana, would you like to close, or should I close? Or Nuala?
Sure. No, with Nuala, would you like to close and just say the last couple things?
Yeah, I think, do you have the slide that we could put up with, just to remind everybody of Dr. Ernst's next meeting? So really just a huge thank you to everybody for coming today, for Christy for joining us, for Kayla and Damaris for sharing your experiences, and yeah, just for everybody giving their time and sharing your experiences with us. And Camilla, it's lovely to see your little girl there. Thank you for for showing us. Oh, we can see Elisa as well. Lovely. So it's really nice. Oh, and there's Sadie. Wonderful. Hearing all about your diet, Sadie. So just one last thing. Did you have that slide, Dana? Will it
Yes.
share?
It's on.
Oh, really? I can't see it. Oh,
Alexandra, can you see the slide?
okay. No, I can see it
Yes,
now.
I can
Thank you.
see.
Thank you. So
Okay.
just to finish up, we were going to have a meeting with Dr. Ernst to talk about the ASO therapy in December, but actually we're going to reschedule that for January. I think people have a lot of stuff going on with Thanksgiving and Christmas, so Dr. Ernst was keen to meet everybody in the new year and just give you a really exciting update on where we are with that therapy. So that's going to be on Sunday, the 12th of January, sorry. Sunday, the 12th of January at 11 a.m. Eastern US time. So that would be same time as this meeting, really, 4 p.m. UK, 5 p.m. Central Europe. He's going to be joined by another of our researchers, Dr. Alessandro Sessa from Italy. And please feel free to bring your doctors. I know it's a weekend and your doctors may or may not want to join, but it would be good to have their input at this point. The ASO therapy is progressing really well, and this will be an exciting update for everybody. We will place a post in the group. Please reply to that to tell us if you're going to come. And really importantly, it's really helpful for us to know if you are planning to come, because then we can organize the interpreters to make sure that people from around the world can really have an active part in these meetings, which leads me on to say a huge thank you also to our interpreters who've joined us today, and Plinio as well. Without you, we couldn't run these multilingual meetings. So huge thank you to all the interpreters as well for your very impressive live interpretation, which having heard you a few times, I'm still incredibly impressed every time that I hear it. So I think that's everything, unless anyone else on the trustee board has anything they would like to say. But if not, we will look forward to seeing you all in January. And do remember that this, what day would it be? This Wednesday is our awareness day. So think about, sharing awareness and definitely share pictures of yourself and your kids wearing purple on our group this Wednesday, and we will all be celebrating our very special children this Wednesday on International SGS Awareness Day. We'll see you soon.
See you. Bye.
Bye-bye,
Thank
everybody.
everybody. Bye.
Goodbye.
Bye-bye.